Hi everyone, Dr. Nemechek here. I want to kind of review how people do with patients with long COVID, how well they do when you use the Nemechek protocol. Now, if you have long COVID or somebody you care about has long COVID, you're generally out there reading this and that. And one thing you see all over the place is all this talk about inflammation and then a lot of talk about these kind of vague symptoms like fatigue and brain fog and just all sorts of stuff, intestinal symptoms, and all the testing's normal. They can't find an answer, and that's because COVID harms you with inflammation. Okay, high degrees of inflammation can injure the tissues of your body, in particularly can injure the central nervous system. And the autonomic nervous system, the part of the brain that regulates all your organ function, your blood pressure, your heart rate, your immune system, your hormones, your metabolism, your emotions, it regulates all of that, is very prone to being injured, okay? Whether it be from a concussion or emotional trauma or a spike in inflammation from COVID. Now, when you go talk to a lot of doctors and neurologists and they can't really find anything wrong, they're basically give you this vibe, well, you can't get better, so here's some pills to handle some symptoms you have. And that's false thinking. It's quite clear in the last decade of research, the brain and the central nervous system is probably the most capable organ of recovery. There's very robust, there's stem cell production, there's neuron production, there's a wide variety of white blood cells called microglia that help repair your brain, and then all these, they're discovering more and more chemicals called neurotropins that help you repair your brain. And the problem is inflammation prevents all that from working. And so, and that's, what happens. You get COVID, hits you hard, gives you a big concussion, and in that process, some people are left with this chronic inflammatory condition, and that actually is a large part of that is coming out of the intestinal tract in the form of, they'll say dysbiosis, but technically everybody's thinking it's SIBO, small intestine bacterial overgrowth, all right? And that causes this increased permeability, so you get excess bacteria in the small intestine, you get this increased permeability in the small intestine, and stuff leaks out. And surrounding the small intestine, they estimate, is about 70% of your entire immune system. So you have all these white blood cells right there. They're going to react to stuff that's just leaking out. Okay, and just fortunately, the Nemechek protocol, it hadn't even been changed at all for COVID. It works really well in the vast majority of people that come here, and it's just because my whole game is not to try to fix somebody. My whole thing is to just lower the inflammation in their body and let their bodies fix themselves, because that's what happens. And so the majority of all the patients I've had with COVID, with bacteria, they have bacterial overgrowth. And this because when you give them Rifaximin, they do dramatically better. Okay, just with that, they'll say, boy, XYZ almost went away after 10 days of that thing, okay? The only thing Rifaximin can do is reverse SIBO, all right? That's the only thing it can do. It can't get in your bloodstream, can't do anything else. So Rifaximin reverses SIBO, and the mistake that's made is people only treat for 10 or 14 days. And the vast majority of everybody with long COVIDs, they've had neurological damage to the small intestine, and that leads to they relapse very quickly. And so I have people say, oh, the Rifaximin didn't work. I took it for 10 days. Man, I felt good, but it came back within a few weeks. I took it again, and it came back within a few weeks. They're thinking it's not working, when in fact it's working. Okay, it's controlling overgrowth. What you need to do first is you got to put these long COVID patients on nonstop Rifaximin for a while. Nonstop, daily, twice a day, month after month, 4, 6, maybe 8 months, depending on really how beat up they are. And now people are like, oh, is that safe? That's how we've used Rifaximin for 30 years. It's been the primary drug for a liver condition called hepatic encephalopathy worldwide. These advanced liver patients take it twice a day, every day, year after year after year after year. We know it's very safe, and we know in particular because it doesn't get in your bloodstream. Okay, it's almost impossible to have a side effect from it. Not impossible, almost though. Okay, and so you put them on continuous rifaximin, and then you got to add the olive oil, and that helps block from the inflammatory crap in the food supply from vegetable oils and these grain-fed meats. They all have excessive amounts of omega-6s in either the form of linoleic acid or when you're talking about the meat, arachidonic acid. And then you need a very high dose of DHA. Okay, fish oil contains 2 omega-3s, EPA and DHA. And most fish oil has a lot of EPA and a small amount of DHA. You need a high concentration DHA fish oil. Okay, we prefer Now Foods. We're going to have our own brand of high concentration DHA fish oil capsules coming out by the end of the month. But you need a high amount of DHA. DHA is the only omega-3 that gets in your brain. And omega-3 molecules are molecules your body uses to turn off inflammation. So if you get a lot of DHA, you get a lot of that in the brain, and it helps control inflammation. Okay? And I've had some people where they're doing rifaximin, they kind of feel good, and they didn't do the fish oil or the proper fish oil. And once we switch them over, they're like, oh my gosh, what a difference. Okay? And then most of the adults need vagus nerve stimulation. Okay? And that's not easy to get. We have a device we can distribute out of the office here. And what this does is further lowers the inflammation in the brain. If you're a younger patient, say maybe under 35, 40 or younger, you often don't need VNS for the long haul, but you certainly are going to need it to kind of fully recover. Patients older than that, many need long-term VNS to maintain their improvement. Okay. Now, the twice-a-day rifaximin isn't long-term. That's often 4, 6, 8 months till people have this substantial recovery, and then they'll only need a 10-day course every now and then when they can feel their intestinal tract relapsing. All right, so the 2 big problems are getting the VNS, and the other problem is getting your hands on a doctor who's going to write for rifaximin twice a day. Okay, they think they're passing out poison or something. They just don't understand this drug. And that's mainly what people will come here for. They'll come out, you have your first visit, you got a year and a half, we can do Skypes and things like that, text messaging to manage little problems. And usually before the first 12 months are over, they're fixed. They don't need us anymore. And we just do these follow-ups telemedicine-wise, so you only have to have 1 visit out here to kind of get the ball rolling. So hope that's helpful. Hope somebody can get you the rifaximin, and there, have hope you can recover from COVID. Take care. Bye.